right, I'm going to start by putting my name at the top and signing the bottom. I will be performing perineal care on a female with hand washing. I will start by applying hand sanitizer onto my hands and rubbing it in until it is completely dry. Hello, Mrs. Pink. My name is Trisha. I'm going to be your CNA today. How is it going? Awesome. All right, we're going to apply privacy. I'm going to check your wristband. I'm then going to unlock and relock your brakes. All right, I'm going to go get my supplies. I'll be right back. I'm going to grab a wash basin, a blue chucks, a pair of gloves, soap, 6 washcloths, and a barrier towel always placed on top. I'm Miss Pink, I'm back. I'm going to start by putting down a barrier towel and take 2 of the washcloths and put them to the side. Leave 4 of them in there with my gloves. Place my soap, place my chucks. All right, I'm going to go get some water. I will be right back. I'm going to start the water so it can warm up. My gloves before I touch the water. It's warm. I'm going to get everything wet. Plus some extra water. Test observer, would you like to check my water? Thank you. All right, Mrs. Pink, I'm back. Fold all of my washcloths into 4ths. Okay, using proper body mechanics, I'm going to lift up the bed to a comfortable working position. Make sure I have everything set up before I uncover my patient. We're going to move this just down to our feet. Test observer, can I have you stand on the side, please? All right, Mrs. Pink, we're going to move you onto your side in 3. 1, 2, and 3. We're going to place this waterproof pad, and we're going to lay you on your back, Miss Pink. Thank you, test observer. We are going to pull this up to just above the knees. And we're going to pull her gown to below the belly button, just so we're only exposing the perineal area. We're going to get our first tab with soap, second tab soap, 3 tabs with soap. Hold it in. All right. You need to verbalize separating the labia with my first clean tab. I'm going to wash from the top to the bottom in one swoop, working away from the urethra. I'm going to get a new clean tab. Separating the labia, I'm going to clean the other side from the top to the bottom, always working away from the urethra. With the third swipe. I'm going to separate the labia and I'm going to go down the middle from the top to the bottom, working away from the urethra. I'm going to get a new clean washcloth. Separating the labia, I'm going to rinse one side from top to bottom, working away from the urethra. Separate the labia. We're going to do the other side, top to bottom, working away from the urethra. With the third tab, we're going to separate the labia and go from top to bottom, working away from the urethra. We're going to take a dry washcloth and we are going to pat dry. Test observer, can I get you to stand on the side? All right, Mrs. Pink, we're going to roll you over on your side on 3. 1, 2, and 3. I'm going to get a clean washcloth. And one clean tab, and we're going to wash from the vagina past the rectum. I'm going to get a clean washcloth with no soap, and we are going to rinse from the vagina past the rectum. I'm going to get a dry washcloth and we are going to pat dry. Throw that away. Oh, right, Ms. Green, we're going to lay you back. 1, 2, 3. Thank you, test observer. We are going to cover up the patient. Using proper body mechanics, I'm going to lower the bed. All right, Miss Pink, here is your call light. Here is your water. Let me know if you need anything, okay? I'm going to remove privacy. I'm going to come to the sink, pour out my wash basin, rinse it. And dry it thoroughly, making sure there's no water spots on the inside and outside of the wash basin. Usually I would leave it here, but because of the camera, I'm going to move it over here. I'm going to remove my gloves properly so that I never touch the outside of the glove and so that they end up inside out. Dispose of them. I'm going to turn on the water and get my hands wet. Get soap on my hands. I'm going to rub my hands together with soap for 20 seconds. I'm going to interlace my fingers, pointing them down. I'm going to get each individual finger. If I have a ring, I'm going to get below that ring, underneath that ring. I'm going to rub together, making sure that I get all 20 seconds in. And then I'm going to get underneath my watch. Check my time and rinse. I'm going to rinse, making sure that I do not touch the side of the sink with my fingers pointed down at all times. I'm not going to flick my fingers. I'm going to let them drip dry. I'm going to dry my hands. I'm going to get a clean paper towel. Using the clean paper towel, I'm going to turn off the water. I'm going to grab my supplies and return them to where I got my equipment, and because I just washed my hands, I do not have to use hand sanitizer. Task complete.